Hi, this is Connie Haxby, licensed clinical social worker, and today, coming upon the fall weather, one of the things that I wanted to address was seasonal affective disorder, which is SAD for short, SAD. And a lot of you can probably relate to having seasonal affective disorder, may not even know what it was, but basically what happens is that when winter time comes in a lot of the climates, and we're not seeing the sun as much. It's getting darker earlier in the day, and the sun is not coming out as early in the morning. What happens is we have this lack of sunshine, and a lot of folks have contributed to a lack of vitamin D because we get vitamin D from the sunshine and other sources, and so we have this lack of vitamin D going on, which contributes to sometimes some feelings of sadness and depression and loneliness and lack of motivation, and a lot of those feelings that we tend to think of when we think about feeling sad, SAD. So one of the things that you can do for seasonal affective disorder is to try to get outside as much as possible when there is some sunshine going on. There are also some special UVA lights that you can buy on Amazon or other internet channels that you can look at and see if there are some that are within your price range that you can use. And you can use those for, 10, 20 minutes a day, and that would give you the lights and the vitamin D that you would normally be getting from the sunshine. But when it's not out and you go weeks at a time, if not months, depending on where you live, then it can really hamper your mood. Another thing is to just make sure that you're keeping up with, reaching out to folks, having some sort of social life, because we'll tend to isolate and not reach out and not get out as much, I think, during the winter months as we would during the summer and when the weather is nicer. So you want to make sure that you're also making plans with folks, whether it's family or friends or your kids or your parents or whoever, and make sure that you're getting out and you're getting that social interaction, whether it's just meeting up for lunch or meeting up for dinner, going to a movie, making sure that you're keeping that up as well. Another big component, and you're going to hear me talk about this in a lot of the videos that I do, is physical activity. I can't stress enough how much physical activity and exercise really does help your mood. So just make sure that you're getting some physical activity during those months in the winter as well, and that should also help your seasonal affective disorder. One thing to keep in mind, and this goes back to like the cognitive behavioral therapy videos that I've done as well, is that you also want to keep in mind that it's not going to last forever. So when you look outside and you see those days that are sunny, make sure that you're getting out and you're enjoying those days and taking advantage of those days. Remembering that the winter months are typically only about 3 months long. You do have fall, which, that's the start of that season, and then the spring, it does take a little bit of time to get up to that weather being what we want it to. But just know that this is temporary. It's not going to last forever. Maybe remember how great you feel when the sun does come out and you see the spring and the flowers and it's a new beginning. Take some solace in the fact during the fall, which tends to be a favorite month for a lot of folks. Focus more on what you get out of the fall season than what you're going to be having to deal with the winter season coming up. So remember those couple of things, and that should help you out with your seasonal affective disorder this winter and all winter months coming up. Remember that these videos are for informational purposes only. They are not used to treat or diagnose any mental illness. If you have any questions or concerns about mental illness, seasonal affective disorder, medication, or anything medical related, please feel free to contact your healthcare provider and get those questions answered. As always, have a great day.